Hi, myself Dr. Yadati Santosh Deepthi, Consultant Neurophysician in Prathima Hospital, Kukatpalli, Hyderabad. Today I want to give some information about Alzheimer's disease. June being the Alzheimer's Awareness Month, I just want to emphasize the importance of dementia, especially Alzheimer's dementia. So, how common is the Alzheimer's dementia? It is the most common cause of dementia. Dementia means, as we all know, that is impairment of memory, leading to impairment in his day-to-day activities. So, they cannot do their day-to-day activities because of the underlying issues with memory, behavior, or visuospatial, etc. So, because of these issues, they will have impairment in their day-to-day activities. So there are many causes of dementia like vascular, frontotemporal, Alzheimer's. So every dementia has its own specific features. Like in Alzheimer's, we have memory issues. In frontotemporal dementia, they will have more behavioral issues. So now, as June being the Alzheimer's Awareness Month, I want to discuss little about Alzheimer's dementia. It is the most common dementia, as we all know, and usually the age of presentation is above 65 years of age. But some may get at around 40 to 50 years of age also when they have specific gene abnormalities, or when they are being suffering with Down syndrome, or some other rare cases they will have the presentation little earlier, that is around 40 to 50. Otherwise the age of having Alzheimer's dementia is 65 years and above. So usually 1 in 10 will have Alzheimer's dementia when the age is above 65 years. When the age is 85 and above, almost one third of the people aged above 85 years of age will have the Alzheimer's dementia. So, what is the problem with Alzheimer's is that they will have issues with memory, they will have issues with behavior, with language, with their learning, with their thinking, thought process, and they will have impairment even in visuospatial, like guiding themselves around the house, they will have difficulty. So, they can have issues with any of these things, but majority will have issues with memory. They will have impairment in their autobiographic memory, that is, they will not be remembering their school, their workplace, their birthplace, and their friends, families, faces, and their autobiography, like their own autobiography, they will be forgetting, and they will have impairment in the recent conversation. They will keep on repeating the same conversations as if they are telling for the first time, and they will have impairment in short term memory, working memories. They will have more of memory issues. So Alzheimer's will be of different grades. Like many will not have severe grade, but they can progress. Usually there will be preclinical stage, minimal cognitive impairment, mild, moderate, severe cases. So in preclinical, no one will come with any symptoms. Usually when any family members having a significant family history of Alzheimer's dementia, for research purposes, we can have their scanning, like amyloid scanning, before the usual age of presentation. So they will not have any symptoms at the preclinical stage. So that is the stage, initial stage. Next comes the minimal cognitive impairment, means they will have little issues when compared to the same age people. Suppose we take 65 years old around in their colony, patient who has minimal cognitive impairment, they will have problem compared to the other people around of same age. But they can do their routine activities, like every household activity or outside activities they can perform. They still didn't have dementia, only minimal impairment will be there. Next comes the mild, moderate, severe cases of dementia will be interfering with their day-to-day activities, that they will be forgetting the things where they have kept, and they will be go on searching and wasting their time, that impairing their time there. And they will have a language abnormality, like they don't know what to speak, what word to place there to give the exact meaning of the conversation. So they will have issues with the language. But here in this mild stage of Alzheimer's, they will be recognizing the familiar places, they will be recognizing the familiar faces, they will not have issues in roaming around. So this is the mild cases. In the moderate, before going into severe stage, in the moderate cases, there will be more confusion, more memory impairment, and more impairment in their day-to-day activities, forgetting the familiar faces also sometimes, more distant relatives. like that. But in the severe stage means they need assistance for their day-to-day activities, like even for bathing, for brushing and for eating they need assistance. So in severe forms of dementia they will be total erase of their memory, they will be dependent on people around for their day-to-day activities. So the people need not be having the severe dementia in the initial stage itself. It starts in the preclinical to a minimal cognitive impairment to the mild moderate severe cases. Usually the lifespan after being diagnosed as Alzheimer's will be, it is variable. Some will have 4 to 8 years of lifespan from the time of diagnosis. Some will even live for 20 years of age. It all depends on the caregiver support and the certain supportive medications. As such, there is no cure for Alzheimer's disease, but there are certain medications which can help in memory issues and behavioral issues, and they can help to continue their day-to-day activities to some extent. No medicine will stop progression of the Alzheimer's disease. They have just symptomatic improvement will be there with the medications currently available nowadays. It all depends on the caregiver support. We should not confront with them. We should not argue with them. We should not scold them. We should give little comfort. We should pamper them, and we should not change the environment where they are living. They will be so much confused when they are go on changing their room environment or their house environment, thinking that the change in place will change their mind, but they will be more confused if they go to a new place, because their memory is so poor that there will be so much confusion with memorizing the new places. So don't change their places often and give them more comfort. Don't confront or scold them. So medicines currently available will have only symptomatic improvement in their memory and behavior, but there is no cure as such. Can we prevent going into dementia? Can we avoid Alzheimer's dementia? Means we cannot avoid the age factor and the genetic factors here. If some people has genetic risk factors, like some genes play a crucial role, if they are positive with that gene, then we cannot stop getting the Alzheimer's dementia. But there are certain things prolong the duration to get the disease. Like if we are mentally, physically, socially active, then we can avoid getting the Alzheimer's dementia. Mentally active means playing the board games, playing the Sudoku or crossword puzzles, and playing any musical instruments, and learning new languages, having the hobbies. So these kind of mental activity and physical activity like exercising, and social activities like being in a group, attending exercise activities in a group, or any religious activities, group activities, or meeting often in a group. So socially active people will also have less chances of getting this Alzheimer's dementia. And eating healthy, so avoiding the high processed sugary foods and junk foods, eating more greens and fruits and vegetables will delay the age of getting the Alzheimer's dementia. So we can avoid and we can even treat certain part of Alzheimer's dementia, at least in the initial stages. But try to give more comfort and more love to your loved ones, because there is no cure. We can only give certain comfort to them. So they will not be asking their food, they will not be memorizing to drink their water, and so they will always be on the bed. So they will have more chances of getting infections, more chances of getting pneumonia. So little care will avoid these complications and make them live longer. Thank you.